Hello, everyone. Just want to let you know I'm having some sound stuff that I want to work out if you can give me a moment. But hello, hello, hello. Welcome to week 12. And sorry about my screen, too. I was kind of doing some stuff. Hang tight. Okay, everyone. I'm not sure if my how my sound is. If you can help me out, that would be fantastic. And while we're at it, I want to say hello, hello, hello to my team. We're going to begin with Mr. Sandeep. Let me see if Mr. Sandeep is here. I didn't even check. Not sure. No, I don't see him. So he might come in a moment. All right, I just want to say hello, team. Hi, Miss Mills. Thank you. Janet, thank you so much for letting me know that you can hear me. And Ms. Mills, thank you too. Hello, 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 Miss Haley. Hi, Miss Beth. Hello. Is Miss Leslie here? Not sure. I didn't see her yet. But hello, 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 everyone. Welcome to class. Let's go ahead and get started. This is week 12. You all made it. You made it thus far. And by now, you should know that the purpose of class is not to instruct. Our purpose is to hold you accountable, to keep you on pace, right? And we want to be more accessible to you. So we welcome your questions. And we want to review what you should already know and give you tips on how to navigate your course. And of course, we want to point out those key guidelines. Now, just so you know, if you didn't know, this is not our MCDC course, our medical coding dual course at AMCI. It isn't. So some people do confuse it. Now, just a reminder, we meet every week at noon. And also, if you have a suggestion after the 16 weeks on a class or course, let me know. Put it on on your survey. All right. Also, want to remind you that on Fridays, that's tomorrow, Mr. Sandeep has these CPT mastery classes, and he's in sync with this class. So if we're studying CPT cardiovascular, he is too. Also, I want to point out that I'm not teaching this in a way where I'm teaching how to code step by step. No, we are like beyond that because there's a presumption you've already done your homework and that you kind of know some stuff. So I'm beyond that. And my focus is getting you ready for testing, not during exam prep time, but kind of in concert or in sync with your instruction, if that makes sense. But if you need Mr. Sandeep, and most of you may, he goes in step by step on how to code. He explains in an amazing way, and people are saying it. So please go ahead and make sure that you go to the Friday class. I believe it's at 1 p.m. right here on YouTube. Also, we have the interactive medical terminology and A&P that's in Discord. And the MCG is, man, how can I say it? You're going to see it this month. Yes, the 2026. All right. So for those of you that are new, and this is your first time, you need to register for this class just to kind of be kept up to speed. Go to www.amcicoding.com and click on that YouTube course. Yes, click on it, register, use this enrollment form to register, and download your syllabus. Follow the syllabus in order. There you go. And you're going to be piped in. You're going to know what's going on. All right. So again, from your syllabus, we are on week 12. And under the RSVP section on your syllabus, it looks like this. You just click on that link. And when you click on it, you're able to RSVP for class. In fact, you can RSVP for all classes at one time. You click on the link, it will bring you to a screen like this. Then you'll click on that notify me button. Then like it up. Then turn on your notifications. And you can do that for all remaining weeks. Also, from your syllabus, you have your textbooks. And for this class, pretty much the CPT is what you'll be using for this class. But for the homework and everything, you'll need the CPT, HCPCS, the MCG, as well as the Bucks textbook. Okay, everybody. I was just told that my mic is not working. So this is how I sound. And I want to know, how do I sound? Is it terrible? And if it is, I can switch to another microphone. And that's really what I want to do because I think I have an echo. Go ahead, let me know how I sound. And I think it's going to take me, yeah, Miss Case. Yeah, click on that like button. That's Miss Case. I am going to try and change out my mic. Hang tight, okay? Okay, I need your help. I need to know how my sound is. All right, thank you, Ms. Mills. So let me know if you can hear me. All right, good. I'm glad you can hear me. How is my sound? Okay, Miss Haley said I sound great. Good, good, good. So this is my backup. Let's go. Thank you, team. All right, so also from your syllabus are the instructions on how to join Discord. You do not need to join Discord, especially if you're already in a course. A lot of you are, so you don't necessarily need it. It might be overkill, but for those of you that are studying on your own, I do recommend it. There are additional resources, study materials in there. Also, access to the AMCI instructors and interns. Yeah, they're in there to answer questions. Also, those private classes that I was talking about, like I'm Tap, Friday Night Live, Friday Night Live, and Test Taking Anxiety, all are in Discord. And yes, you do have to pay that small amount, that at least $2.99 to get that. Now, if you are a gold student, a gold online student, all of your resources are in your course, other than you do have to go to Discord to attend classes. Now, I do want to say this. When you complete this session, you're not quite ready to test. If this is your only like instructional piece, you're not quite ready. You'll need to do some exam prep and specific to the CPC or CCSP, whichever track or exam you're going to take. And then you're also, if you're taking the CPC, you'll need to do the AAPC practice exams.
ABC, DEF, or both. It's your choice. Then you're ready to test. And whatever that score is on this AAPC practice exam, that's likely going to be your score when you take your exam. And I want you to tell me, is that true? Mrs. J, is that true? Somebody said the first microphone was better. Thank you, because this one is a cheap one. So I needed to know that was good. So definitely, if you take your exam, your CPC exam, and you also do these practice exams, let me know if your score was kind of consistent. I believe so. I do. All right. Someone said, will this be uploaded to YouTube? Absolutely. Absolutely. All right. So let's get started. Well, we've been started, but let's finish up. All right, so the syllabus looks like this. You should have completed all 13 steps. If you didn't get to it, it's okay. This is a reminder that the playbacks are on the green click here. These are your playbacks. I do want to point out number 13. We do have that optional YouTube video library. Type in the chat if you are um, if you're looking at those video library, our library, I think it's helpful. And I really think it's helpful for cardiovascular. Definitely, because it breaks down each of the all of the guidelines for each procedure. So if it's cabbage that you want to know about, you can just look at the video for cabbage as opposed to looking at one long video. So this is nice, is step by step. So far, it's spot on. And yes, it's not that we allowed, it is AI, but it's not like we allowed AI to generate anything. No, we gave them the facts, the data to talk about. So I think I think they're pretty good. Let me know. Okay. All right. All right, so Janet says she started. That's what I'm talking about. All right, so just want to point out that this is your playlist. You're going to see for this class, this is where you'll find your playback. It'll look like this, okay? It's the green and purple or blue, whatever color that is. So you should follow the videos in order. But I want to remind you, this is not the class. The class is on the syllabus. Follow the syllabus and watch the videos as outlined on the syllabus. All right. All right. So if you are an AMCI, if you're a gold online course student, this is everything you need. It's just like your syllabus and it is in order. And also, those resources that are in Discord are also placed in your course. Now, want to remind you and everybody that this gold course is not our MCDC course, it's our YouTube course. Yes, these are the YouTube videos in this course, and we did add some quizzes as well. So you get a little more practice. Not a little more, a lot more practice. All right, so now look at this. Let's go ahead and test your knowledge. And this week we're talking about cardiovascular system. And I really want to hone in on um, pacemakers. What do you know about pacemakers? So I got some true or false questions. You all ready? Okay. True or false? When coding pacemakers and defibrillators, skin pockets are generally coded separately when coding a pacemaker. All right. True or false? What say you? Hi, Vina D. Vina D. Vina D, if you all didn't know, she passed her certification and she's still with us. That's what I'm talking about. Outstanding. Okay, so those answers are coming through, and the majority of you have said false. That is true. If you know the guidelines, you know that pacemaker skin pockets are generally bundled, right? So whenever you're rearranging it or putting it somewhere else, then you may be able to code it. But generally, those pacemaker pockets, this is where they keep the battery, these are bundled into the code. All right, good job. That's right. Great job. Great job. Janet, Lucky, Vina D, Delicia, Health Messages. How are you? Yvonne and Letre. Go ahead and spell that phonetically for me. Hi, Meredith. Great job. Great job. Okay, everybody. True or false? Intravenous or intravenous pacemakers are placed epicardically. True or false? Intravenous pacemakers are placed epicardically. Hi, Yvonne. Yeah, they're shouting you out in the chat, Vina D. Yes, congratulations. Good job, good job. Okay, true or false? If you all didn't know, I'm going to just talk. So, whenever they're placing these pacemakers, it involves two things: your battery and the wires or the leads. They can place those leads one of two ways: through the vein, they can fish it through the vein, or they can go through the chest and place the lead or the wire epicardially, like around the heart, right? So, true or false? So if they're fishing it through your veins, you cannot place it epicardically. You have to go through the chest for an epicardial placement. So this is false. Okay? And that brings us to a gem. Epicardial is outside or around that heart, and typically it's placed through the chest. Surgical placement, like they're cutting you open to do that. Oh, no, not necessarily. They can do it thoracoscopically, but it's more invasive. They can go through and directly to that heart and place the lead. Whereas transvenous, that's inside the veins, right? Inside the veins, and fish it through that way. All right, great job, everyone. Number 3, true or false? And I know that if you answered and it may not have been correct, you had an aha moment. Good job. And for those of you who didn't answer, hopefully you had an aha moment. All right, true or false? When coding pacemaker defibrillators, it is essential for the provider to document the number of leads because code selection is also based on the number of leads. True or false? What say you? Yes, the answer is true because the codes are going to be written as dual, single. So singles one lead, dual placement two leads, biventricular, that's multiple leads. So it could be in both ventricles as well as the atrium. So that is true. You need to know the number of leads. Good job. All right, true or false? When coding bypass grafts, now we're moving on to another procedure or cabbage. All vessel harvests are bundled into the primary procedure. True or false? So when we're saying harvest, when they're taking the graft from another part or another place, it could be someone else too, but typically from the person, and then they put it, they apply it to the heart to bypass the blockage. That makes sense, right? So they have to get the graft from somewhere. So this is saying that all vessel harvest grafts are bundled into the primary procedure. True or false? What say you? All right. So the answer is false. Now, coders, if you're saying, well, how are we supposed to know that? These guidelines are addressed in the lecture, and one key guideline is that all harvests of are not bundled, right? So the lower extremity grafts are bundled, and the upper extremity grafts are coded additionally. So that leads me to this gem. Always remember, lower extremity harvests or grafts are bundled except the fempop, your femoral popliteal graft that's right behind your kneecap. That is coded. It has its own code. All right. So I think we learned something. If you didn't, you learned something. Outstanding. If you got it correct, outstanding. All right. True or false? When coding bypass grafts, the endoscopic procedure harvested is separately reported. True or false? So if they harvest the graft endoscopically, it's separately reportable. True or false? What say you? I know that's right, Miss Haley. Miss Haley said, hopefully we had some aha moments. That is correct. I hope we did. So definitely let me know in the chat. I was moving just a little bit fast at first and really wasn't paying attention to the chat because I needed to kind of catch up for my time that I missed early on. But now I'm locked in on this chat and I'm paying attention. And I want to say hello, Janet. Hi, Dimitar. I think I could say your last name better, Dimitrovsky. I hope I said it right. Hi, Josephine. Delicia, I already said hi to you, but I want to say it again. I love your name. All right, Sarah, Yvonne, Meredith, let's go. You know what? The answer is true. Outstanding. Absolutely. Anytime there's a endoscopic procedure, you're going to code that endoscopic code. There is one for 33508 for veins and 33509 for arteries. And let me tell you, even if the procurement or the harvest, the code for the getting of that um, vein or whatever or artery comes from your lower extremities, you still, if it was done endoscopically, you will report the endoscopic add-on code. Okay? So while you might not code for that harvest, you will code for the endoscopic procurement as well. I hope that makes sense. I do. I know, Miss Beth. Woohoo, you guys. Hi, C Primo. Hello, hello, hello. You guys are rocking it. Now, just want to remind you, you need to be familiar with general CPT coding guidelines. The surgery. Be familiar. It's the green pages at the beginning of the surgery section, right before integumentary system. You're going to have to apply them when it's applicable. Also, you have to be familiar with specific cardiovascular CPT guidelines. Also, in this week 12, we do talk about digestive systems, but we're not going to talk about it today. But you should be familiar with specific digestive system guidelines. Also, be familiar with the layout of the cardiovascular sections of CPT. You should know that the first main topic will be your defibrillators, your pacemakers. That's one of the first main topics. So just kind of get it in your head so you can always flip where you need to. Now, I want to take a look at these guidelines. The guidelines that I was telling you about that you should be familiar with, these surgical guidelines, be familiar. They look like this. These are the guidelines. And remember, these guidelines apply for the chapters 10,000 through 60,000. Now, what I suggest that you always do when you're studying, go to the table of contents. And I told you last time or the time before that, anytime you see an asterisk, read it. See that asterisk right there? Read underneath. Definitely. That's valuable information. And also, this is where I learned that the asterisks provide you with guideline nuances. So if the procedure or the category or the category or the procedure has a asterisk, that's telling you that there are some nuances. So, the nuances are for, procedures of the pericardium. And then you go to pacemakers, there's a nuance. And then you've got, this phrenic nerve simulator system, a guideline nuance, etc. And then you can go to the other side and pay attention to those procedures that have nuances. Now, I've made a list of common topics or procedures that you're going to find on the exam, and here they are. The pericardium, this is basically where you'll find your pacemakers, right in there. Wait, no. Let me see. Yeah, that is where you'll find your pacemakers. I do apologize. Then your valve procedures, endoscopy procedures, cabbage, transplantation, heart transplantations, and look at anything with an asterisk. Why not? Make sure you read all parenthetical guidelines. You're going to be good. Also, I love the fact that there are diagrams and images in your table of contents because this is where you can reference. If you have a question, an anatomy and physiology question about the flow of blood in the heart, my advice is when you watch the lectures, we tell you how, we number the flow of the blood in the heart. So we chant it for you. So if you have that question, you're going to get it right. Yeah. So definitely use these diagrams to your advantage and use it not just for AMP, but for med term as well. So if you want to document key medical terms, do it. Now, if we're going to the next pages, we've got aneurysms, embolectomy, thrombectomy, endovascular repairs, vascular injection procedures, your dialysis circuit, and transplantation. And we have more anatomy pictures, and this is for the arteries as well as the veins. And we also, at the end, have these lymphatic system. So your nodes. And there you go. Now, I got questions. All right, so this is kind of like, it's not true and false, it's kind of multiple choice. But I just, it's, pacemakers and cabbage are really, really important. So I just kind of wanted to nail that. But the discussion today will be on valves. Okay? All right. Of the following, which best represents a true statement about coding pacemakers? And if you have an MCG, go ahead and open it up, turn to pacemaker FTRs, and look at those guidelines. A, you may use the CPT pacemaker chart for open pacemaker procedures. B, a pacemaker pulse generator is a battery. C, only report pacemaker generator replacement when the battery is fully depleted and no lead work is performed. D. Transvenous pacemakers are inserted through the chest. What say you? Go ahead, type your answers in the chat. I think this is a good question because you can get answers. I'm going to just tell you that the answer is B. This is the only one that's correct. A, you may use CPT pacemaker chart for open pacemaker procedures. Absolutely not. Only transvenous or through the vein procedures may you use the pacemaker chart. Type in the chat if you know what I'm talking about when I say the pacemaker chart. Type in the chat. Let me know. Do you know? Also, a pacemaker pulse generator is a battery. So if you have a scenario and they said, hey, we're changing the battery, you know that's a pulse generator. All right. So some people say, hey, they're using the chart. They know what the chart is. All right. Also, only report pacemaker generator replacement when the battery is fully depleted. Okay, that's obvious. That is not correct. And D, transvenous pacemakers are inserted through the chest. We know transvenous is through the vein, right? Not through the chest. All right, good job. So let's make that in a teachable moment where we can learn other stuff. And then we got the outstanding going up. Thank you, Mr. Sandeep. And you all are rocking it. That's right, Janice. That's right. All right. Of the following, which best represents the most accurate statements about coding cabbage? A. Code selection is based only on whether the graft is arterial and venous grafts are included automatically. B. Each coronary artery bypass graft is coded separately regardless of whether the graft is arterial or venous. C. Code selection is based on the number of sites bypassed and the type of graft material used, whether it's arterial or venous. And D. Only venous grafts are reported because arterial grafts are always bundled into the primary cabbage code. What say you? Go ahead, type your answer in the chat. And I apologize. I'm calling Casey Case. Your name is very similar to our intern, so I do apologize. And hello, Casey. All right. Raina, I'm going to call you Raina because I don't know if I'm saying Laterre correct unless you spell it phonetically for me. Okay. Good job, Janet, answering. Good job, Vina D, answering. Good job, Meredith Cox. Good job, Brenda Whiteside. How are you? Okay, there. That is Case. Okay. Hi, Case. All right, everybody. The answer is C. Code selection is based on the number of sites bypassed and the type of graft material used, whether it's arteries or veins. That's it. All others are false. All right, let's go. You all are rocking it. Oh, what is that? Okay, I do have something on my screen. There you go. Now, of the following, which best represents the most accurate guideline for diagnostic studies of the cervical cerebral arteries? You know, that's coding for those families, those um, families, right? Arteries and veins. All right, a code selection is based solely on the number of images taken, regardless of the catheter placement. B, selective catheter placement is when the catheter does not go beyond the aorta. C, catheter placement must always be coded separately from diagnostic cervical cerebral angiography because it is never included. Or D, an example of non-selective catheter placement is when the catheter does not go beyond the aorta. A, B, C, or D. What say you? That's right, Miss Haley. They are rocking it indeed. Let's go, everybody. Just give your best answer. And you know what? As long as you answer, you are You're amazing. That's right. Amazing job, coders. I'm going to wait a few more moments and let some more answers come through. All right. Case, Vina, Raina, Dimitar, or Dimitar, I don't know how to say it, Meredith, Yvonne, Janet, B. Frazier, Brenda Whiteside, all have said the same, and the answer is D. Yes, non selective catheter placement is when the catheter does not go beyond the aorta. The physician is not selecting where that catheter is going, it's going to stay at the aorta. The answer is D. Okay, great job, everyone. Great job. So now we're going to turn attention. We're going to do something a little different, and you're going to hear me have a discussion on the valves. This is a topic that we just don't typically have. We always talk about those, um, the pacemakers and defibrillators and the cabbage procedures, and we just don't really give as much attention to these valves, and they're important, right? They are. And if you didn't know, we've got four valves, right? You've got the aortic valve, the mitral valve, the pulmonary valve, and the tricuspid valve, right? And let's talk about these valves and let's talk about why we would repair these valves. Typically, they're repaired if the patient has one of two common problems. The first is stenosis, and the other is regurgitation. Now, stenosis pretty much says that the valve is, it just won't open properly. So, for some reason, that valve could have some wear and tear, and that heart valve is too narrow or narrowing. That means stenosis. Now, if it's too leaky, the patient could have regurgitation, and it can't, and both are not functioning properly. And as you can see at the bottom, this is how they should function. This is a normal opening of the valve, and this is normal closing of the valve. And the valves open and close to let blood pass through the heart. So these are very, very important. And these valves, you know, these valve problems can occur over time, like aging, wear and tear, or the patient could be born with this type of or these one of these types of defects. And some infections, like cardiovascular infections, like carditis or endocarditis, this could produce um, this problem, mainly regurgitation. That bacteria could really impact that. Rheumatic fever and other degenerative changes could cause problems within the heart. So let's just leave this conversation with stenosis means the valve is too narrow, the valve opening is too narrow, and regurgitation means it's too leaky. Now let's turn our attention to some common procedures to repair these conditions. So these are open heart procedures, and you can either have a an open procedure or a transcatheter procedure. That's all I'm going to say. So one's open, they opened the chest, and the other one could be transcatheter, where they go through the chest with a catheter. And as you can see right here, they have the stent that's going to repair the valve defect. All right, so let's take a look at the open valve procedure. This is a traditional surgical approach. The chest is open with the sternotomy. The patient is placed on the cardiopulmonary bypass. So that cardiopulmonary bypass is breathing and also pumping for that patient. The aorta is opened up. That disease valve is removed or repaired, and that new valve is sutured in place. And this includes procedures like 33405 through 33430, and this is the aortic valve repair. And in 33496, this is a mitral valve replacement. And then there are other codes as well. So it's really important that when you're looking at this documentation that you distinguish if it's an open procedure or transcatheter. Why? You're going to know in a moment. These open procedures are pretty much straightforward. It's these transcatheter valve procedures, the TAVR, TAVI, that requires you to pay attention. And we're going to talk about it in a moment. But just generally, there's no sternotomy, so they're not opening the chest. A catheter inserted through a blood vessel, typically the femoral artery, and then the replacement valve is delivered through the catheter. It expands and anchors inside the old valve, and it includes code series 33361 through 33366. All right? And so each of the valves have their own TAVRs and TAVI codes. And this is what it looks like. So what I did was I created a quick reference chart, and on the right you see the valve procedures, and I believe this is for the aorta. So these are the aortic codes, and let's see, and these are as well aorta. These are all aortic. Now, I did create this quick reference, and essentially, this is basically what is bundled in this TAVRs and TAVIs. And that's why I said the transcatheter procedures have the most nuances because they have items bundled in it. So, percutaneous access in sheath, that's bundled, so you're not going to code it additionally. You're not going to code balloon valvuloplasties additionally. It's bundled into the codes. The valve deployment and repositioning is bundled. Temporary pacemaker insertion, that's not reported. That 33210 is not reported. It's bundled. Closure of the arteriotomy is included. The image guidance is included. So don't report angiography codes. Don't. Also, your open arterial cardiac approach, the approach is bundled, and the coronary angiography, you only report it separately if diagnostic meets criteria, but generally it's bundled. But if it meets that separate procedure requirement, you can code it separate and append that 59 modifier. Also, the cerebral embolotic protection, this is not bundled. You use the 33370. The VAD, that device or balloon pump support, you're going to code it additionally. You're going to code cardiopulmonary bypass additionally, and you're going to code, if you have multiple valves, you use the add-on valve code and modifier 51. So this is just kind of like a reference sheet. So if you want a screenshot, you can do it, but also we do have a playback, so don't worry about it right now. All right, now I'm going to do a procedure, and we're going to code this out together, right? Okay. All right, of the following answers, select the correct CPT code for this procedure. A, 33365, 33367, B, 33365, 33368, C, 33405, and D, 33410. Operative details. This is our operative report. The patient was taken to the operating suite, placed supine on the operating table, and general anesthesia was induced. A median sternotomy was performed, and the pericardium was opened to expose the heart. Heparin was administered to prevent clotting, and the patient was cannulated for cardiopulmonary bypass. Once CPB was initiated and the heart was arrested, the aorta was cross clamped. The aortic root was opened to expose the aortic valve. The diseased aortic valve leaflets were excised. The analyst was sized, and the selected stentless tissue valve was implanted with a continuous suture technique. The aorta was then closed and the heart was reperfused. After reperfusion, the patient was weaned from the cardiopulmonary bypass machine without difficulty. The cannulae were removed, heparin was reversed, and the chest was closed in layers using a standard technique. Hemostasis was satisfactory. The patient tolerated the procedure well with no immediate complications. The patient was then transported to the ICU for closed postoperative monitoring. I know that's right. Whoever that is, I don't know who you are, but you are saying, let's do this. Let's do this. Coders. This is a traditional operative report in the real world. And I'm going to allow you to, give you time to go ahead and answer. But I'm also going to walk you through so that you understand every single thing that took place. All right? Because once you start seeing repetitive procedures and words, it's going to make you that much more confident, not only on the exam, but in the real world. You'll be able to actually read an operative report confidently. So go ahead, answer the question. Okay, coders, for the sake of time, I'm going to continue. And I'm glad you all have started answering the question. And I really didn't give you a lot of time. So great job just taking the initiative. And one person said, hey, this is not transcatheter. So I'm going to get rid of these two. I love it. I love it. I love it. I love how you broke that down. But let me tell you what I'm going to do. I'm going to say to myself, which valve? Because once you nail which valve it is, and in this case, it's aortic valve, and up at the top, it's aortic valve stenosis. So typically in an operative report, it would say that diagnosis. So it's the aortic valve. All others are going to be eliminated. All right. So what took place? Well, I there were about 19 procedures, right? And we're going to go through them. So the first thing that happened, well, the first thing that I'm going to say is the diagnosis is aortic valve stenosis. That's number one. The next thing happened was a median sternotomy took place, and they opened the pericardium. So they, incised the chest, and they also incised the pericardium. Next, So I'm going to get rid of them because they are bundled. Next, the heparin was administered, and heparin, I believe, is to prevent blood clotting. They want it nice and thin so that they can carry out the procedure. After heparin, then cannulation. So these catheters, they use catheters and cannulae and cannula interchangeably. The heart was cannulized. And why were they doing that? It was cannulation took place so that they can carry out CPB, cardiopulmonary bypass, so they can get directly to the heart and lungs. So that was carried out. Also, the heart was arrested. Cardiac arrest took place. So why are they going to make the heart stop? Well, if you're performing open heart surgery, you don't want a beating, you don't want to operate on a beating heart, right? That would be difficult. So that is why the heart is arrested. Also, they go ahead and stop the blood flow from the heart, and they do this cross clamping. So they clamp the aortic valve, which is the largest excuse me, aortic. This this is not the valve, this is the artery. So they cross clamp the aorta, the largest artery. Then now they start the procedure. So this is the aortic root incision. They go ahead and incise and access the surgical site. Then they went ahead and they excised or removed the diseased valve. So they, after accessing, they removed it. So we're going to code that. Then they're going to size the aortic annulus. So they need to know what size to put, to insert, and they're going to size it. That's bundled. Also, implantation of the valve, the stentless valve, that took place. So this is the patient's new valve. We're going to code it. Then after that, closure took place. This is how they're going to close up the aorta and the valves, and that's bundled. Then cardiac reperfusion takes place, and that means that they're just going to get the blood going, get the blood going. So they're going to remove the clamps, right? Then they're going to wean the patient off the cardiopulmonary bypass machine. That's bundled. Then they're going to remove all of the cannulae from the heart. Then they're going to reverse heparin because they thinned out the patient's blood, by putting in the heparin. Now we want the blood to be able to clot and do what it normally does. After that, hemostasis is achieved. That's just bleed control. That's bundled. And then they're going to close up the chest. And that's layered closure. And congratulations, you've just completed your open heart surgery. Well, the valve procedures. So essentially, we're going to code for the excision of the disease aortic leaflets. We're going to code for the implantation of that valve. It's a stentless valve. And this is our inventory. Patient has stenosis and the excision and the implantation. And I think someone just said it in a nutshell. I believe that was B. Frazier. She eliminated everything. So let's go ahead and code it out. All right. So just so you know, in the aortic section, you've got your transcatheter procedures. You also have your open procedures. And was our procedure open or transcatheter? Well, we got some excisions going on. The patient had a sternotomy. That means they opened up the chest. This is definitely not transcatheter, right? So we are going to get rid of any code that falls under the transcatheter section. So 33365 is found at both A and B. Transaortic approach, median sternotomy, you all got to go. Boom, boom. Now, our code is going to come from the open section, and right away, we're eliminating 33405. This is the code for the replacement of the aortic valve open procedure with cardiopulmonary bypass with prosthetic valve other than homograft or stentless valve. Wait a minute. This is what's making 33405 because our documentation says that stentless tissue valve was implanted. So 33405 is the code for other than a stentless valve. So you got to go. And 33410, this is with a stentless valve. So that is our answer. And I'm going to say this. I kind of gave it away when I said that cardiopulmonary bypass was bundled because if it's an open procedure, cardiopulmonary bypass is bundled into the code. If it's transcatheter, you do have to code additionally for the cardiopulmonary bypass. So if you retain that, you are going to have an advantage when you take your exam. All right. So here are the key takeaways. And Miss Haley's asking, hey, did the explanation help? But here are the key takeaways. Let me know in the chat if this explanation helped. Quite a few of you got it correct. You didn't even need me. But all of us, we're all in this together. We all learn. We're all, and hopefully the people that got it correct got some gems along the way. But the key takeaways are you need to know, establish which valve, right? Then you need to establish, is it transcatheter or open? And that's more than half the battle. Okay? All right, so this is the end. And just want to let you know that if you got that correct, I know that's incorrect. That's ChatGPT. That's just to remind you, don't always rely on ChatGPT. If you learned something, anything, that is priceless. So here are the final words. Try, this is for next week. This is your homework. If you are in the course, try to complete week 13 before coming to class. This is gold course and follow it in order. And I also want to let everyone know that the AMCI CPT procedures video catalog, that's gold, 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 gold. I'm glad you're happy, Lucky. I'm glad you're happy. This is what it looks like. So this is not cardio. This is InTag, but cardio's got a lot of videos. Maybe um 27. It's a lot. So you don't have to look through them all. You just kind of do what you need, right? All right. So here are the final tips. Remember, class is not for instruction. Remember, you don't have to remember guidelines. Always attend Friday Night Live. Never use an encoder. ChatGPT is an encoder. Never use blind process of elimination. Do not solve your scenario without looking at the code. How are you going to master reading documentation if you're not reading the code? And you're going to need that when you get into the real world. Then you're going to be coming to us saying, AMCI, I need your help. A lot of people do. They do. Like, hey, I don't know how to read documentation. Also, too, if you have a dilemma, because a lot of our videos were created not in 2025, in 2026, 4, 5, always follow your 2026 guidelines. That's going to be your answer. Okay? And also, if you purchase the AAPC Practicode, we advise you to do it after you pass your medical coding exams because it could be a little confusing, right? All right. So I know I went over by 2 minutes. I'm trying to get better, and I'm going to ask my team to put the survey in the chat. Let us know. I love you too, Brenda. I do. Thank you so much for putting that in the chat. I don't know who that is. It might be Mr. Sandeep. Yeah, I think it is. And it was a great session. I hope it wasn't too fast. If it was too fast, go ahead and click on the same link. That is your playback. Yeah. Everyone's so quiet. That procedure might have been kind of overwhelming. Let me know. Okay. So I just want to, on this note, I want to say thank you to my team, Mr. Sandeep, Miss Haley, Miss Case, Miss Beth, Miss Mills. Thank you, thank you, thank you. And I want you to have a fantastic week. I'll see you next time. And I'm going to say so long, Janet. So long, Brenda. Let, let, you know, I'm going to call you Raina. Okay. Lucky. Case. Health messages. Health messages. Hopefully you make it back to the session tomorrow. Yeah, we do pay attention. All right. Delicia. Vina D. DC Kicks. I don't think I said hello to you. All right, Brenda or B Frazier. I'm assuming. All right, Meredith, Yvonne. I know I'm not going to say everybody's name, but you all know. Have a fantastic week, and this was a fantastic class. And again, thank you, team.
4,000 exam passers and free classes at AMCI. Learn to go straight from home or on the road at AMCI.